misconceptions around HRT, and there was a very, very outdated study that has brought a lot of concern not only amongst the medical industry, but has passed along to patients or consumers having fear of going down the hormone replacement therapy route. Can you speak to that and how that has changed, how a lot of those studies were very misdirected, inaccurate, and the evolution of hormone replacement therapy, what it can be doing for people, not only for some of the symptoms that we're experiencing as a result of perimenopause and menopause, a lot of proactive treatment around things of cognitive decline and those sorts of things.
What you're talking about was the Women's Health Initiative. It had many arms, and one of the arms of this study was looking at hormone replacement therapy. It was a very bad study. The statistical analysis they used was wrong. The group they studied was wrong. When you amortized all of their actual data and went back and looked at it, there was no increased risk of breast cancer. Zero. No increased risk of breast cancer. And in that study, those women were not given testosterone at all. They were either given estrogen from pregnant horses, which is not identical to humans, or they were given pregnant horse estrogen with a synthetic progesterone called medroxyprogesterone acetate, which is not recommended anymore. It's a crappy synthetic when we have human equivalent micronized progesterone. It's dirt cheap, generic at Walgreens. There's no reason to get MPA. And so they used the wrong drug and the wrong patient population with the wrong statistical model. Whoops. And so now there's position statements all over the place. The National Institutes of Health has many position statements out saying, I'm sorry, we were wrong. But it took 20 years to get that. And in 20 years, we had 2 decades of don't take hormones, they're gonna cause breast cancer. Well, in a pregnancy, a woman's estrogen will go in the thousands, maybe as high as 4,000. In a postmenopausal woman, we're trying to get her estrogen level to about 60. So if estrogen caused breast cancer, you would be birthing a tumor with every child. And also women who have breast cancer before they go through menopause are not often put on estrogen blockers. They're allowed to ovulate. So you're allowed to ovulate and have estrogen all the time for decades. And those women don't have an increased risk of breast cancer recurrence. Last piece on that Women's Health Initiative study, when they reanalyzed the estrogen-only arm of the study, because that was a much better group to study those women, because they started the estrogen right at menopause. 27% reduction in the risk of breast cancer. So even pregnant horse estrogen is breast cancer protective.